Early on, I think it's the ideal situation to get most of the information from the healthcare team, particularly from your child's doctor. During that time, there are other sites you can go to, such as the cancer.gov site for the National Cancer Institute, the PDQ site, which has a description and has the most up-to-date treatments. Don't yield to the temptation to go to the internet and just Google that, because you will not come up necessarily with the most valid information.
It's too easy to get false information. It's too easy to get caught up in all of that kind of stuff. Try to stay away from survival rates and all that kind of thing. Focus more on the type of cancer it is. Focus more on what types of treatment are most effective.
I chose to stick with the people in front of me and some of the big names. I took information from the Leukemia and Lymphoma Society. If NIH or NCI or any of the big organizations were in the URL, I tended to trust them a little more.
When it comes to dealing with the science and the research and talking to doctors, it definitely helps to just take in the information that they're giving you at that moment.
The amount of information that families should learn about their child's diagnosis really is going to depend on how much you feel like you can take in, how much a parent feels like they can take in. We want them to be part of their child's care. And so if they have a question, if they have a concern, if they've read something on the internet that doesn't sit so right with them, we would much rather them bring that to us so that we can discuss it, so that we can have all of the information out in the open, so we can give them information maybe that might be credible to support or to help them understand what it is that they've read. We want them to talk to us and bring those to us.
I generally recommend that parents get a notebook to keep track of everything. They have questions that come up, to make sure they write those questions down, because then when they see you the next time, they can ask those questions.
I myself took notes on my phone all the time, so that helped me a lot, because there's a lot of big words in, the medical terminology that you may not know and you want to maybe look back into.
I did create a spreadsheet, and it was a daily spreadsheet, and I slapped it on the counter every morning, and I checked off things. There were about 15 or 20 things I had to do every single day for that child that were important to her long-term survival.
A day planner,
would
calendar,
be great.
and
Yep.
understanding the whole treatment protocol and the plan when things had to happen. For example, Jaden had to have radiation and chemo, 2 different hospitals.
I think that calendar, whether you come in this with that type of mentality that you like having things written down, that you're organized, or whether you come in it from a kind of a free spirit type lifestyle, I think those calendars are useful to people across the board.
It's often important to have someone who's not necessarily a family member with you when you talk to the doctors, because you as a parent may be so focused on some of the questions and things that you don't hear everything that they're telling you, and that other person can help you remember some of those things or bring up some issues that you didn't bring up.
I can remember Kim's sister had come down. She has a doctorate in microbiology, and she was kind of running point, so to speak, taking notes and, kind of in taking all that, information to help us at a later time to, just distill it and understand it.